Now, let's move into the panel discussion phase. So, very nice, nice presentations, and I kind of feel that we could discuss a couple of different areas. So, one is kind of like attitudes, one will be future, and the third kind of issues, maybe risks, but let's stay positive anyway. So let's start by, I have one question for each and every one of you. It's a different question, and if you answer that in a short manner, that would be great, so we get the discussion rolling. So let's start with Johan. If you consider like what you see, and you talked about some kind of pilot you had and so on, but considering kind of the potential of AI in healthcare, what would you say is the lowest hanging fruit, where the minimum effort would give the maximum gain?
Yeah, I would say it's by far automating the admin work for clinicians. I mean, our public social healthcare budget is like 27 billion per year, and out of that, well over 50% goes to social healthcare workers, and we know that they use up to 40-50% of their working time doing admin work, mainly documenting or finding information. So that's a question of billions per year in Finland, and we are not focusing on it enough right now.
I'm happy that you say this, because for someone who's outside healthcare, it feels a bit sad that it's not in actually kind of the actual healthcare work, it's in the meta work where the lowest hanging fruits are.
Yeah, exactly, and the professionals, they have trained to help patients, not do admin work. So automating these tasks is a win-win situation.
Great. So then, Jarmo, if you would repeat your study that you presented in, say, 5 years or 10 years, what do you think will be the biggest changes, and what do you hope would be the biggest changes?
I think that the benefits, we should start with benefits. As a taxpayer, I would like that our social and healthcare would be productive and cost-effective. That's one aspect. Another one is the productivity side, and one is the employee job satisfaction part, and patient and client benefits, the biggest one. So we should think about solutions that can help on all those levels. And if I would be a dictator for one day, I would put all the money in those current systems that could incorporate AI functions. So our professionals don't want to be handling 50 programs like today. We should have a nice interface with one solution that could maybe do the admin work, the patient and client work, and that would be the optimal situation in the future, I would say, for all taxpayers and the employees and the client patients.
Yeah, thank you. Shinya, so you've been part of big public organizations, but also small startups. And if you think that AI is going to change things, do you think the change will be led by small agile startups or big initiatives that come from the big organizations?
Yes, thank you. This is a good question, but now we can be as small as possible with the AI technology, as you can imagine. So in Japan, my current startup companies are founders are only 2 or 3, no employees. Then only idea from medical doctor, professor, investigators. Then we do we make a small service or a product as a first step. Of course, we will try fundraise or fundraising or maybe employee hiring later phase. But I mean, POC is much easier than before with the AI technology. And then now I'm feeling that maybe 5 people or 10 people is good enough to be listed company or maybe big company for the M&A. So not only one company as a founder and the CEO, but also like 10 companies as an investor or founders to make valuable, products or maybe services. So this concept is totally different from maybe some years ago, especially for the graph last year. For example, 2 years ago, my university hospital, some founders, founded startup companies. They fundraised 10 million, for example, USD. And then they started to hire people, engineers. But now their business model is totally, not, how can I say, attractive to the investors. So this is, no one is, wrong actually. Because 2 years ago, 3 years ago, no one didn't predict the current situation, of course. But as of now, we need to think about how to make a startup company, how to make an organization. Even we are a big company or a big organization, we should make a small team, internally or externally, whatever. Then delegation is very important, I think, to the team.
Thank you. And then Petja, you mentioned that you have activities across, of course, different medical fields, but also different countries. So what are the challenges in actually delivering AI products and AI tools when there are different types of users and also then there are probably things that are different across different countries?
That's a very good question, and I'm a little sad to answer it that the biggest problems we are facing in Finland, not in other countries. For example, the AI tools we have developed in-house to ease up nurses' work during the calls in health centers. It took like 2 weeks, 3 weeks to be approved in Sweden, and it's still not approved after 10 months in Finland in any Wellbeing Services county, with the same legislation, same EU directives and regulation, and the same documentation. So that has been actually one of the disadvantages for Finland, but also a very interesting topic for us, because our AI team and data science team has actually grown outside Finland, and our implementations are done more and more outside Finland. So it gives us also a very good idea of how flexible or fast-paced other countries are.
That's a bit sad to hear, of course, as a Finn.
Especially here in Espoo.
Good. So let's talk a bit about kind of benefits and attitudes, because I think that's something that each of you addressed in some sense. We already talked a bit about kind of supporting clinicians versus supporting admin, and I think there are initiatives on both sides. But often when I talk to people in healthcare and they heard that I develop machine learning methods, they often bring up the admin side instead of the clinician side. There's also this one number that I saw on the screen that was like 27% of the people in elderly healthcare had encountered AI or used it.
Even once.
Even once. And that sounds like a low number from our perspective, I guess. But would you say that the attitudes in the admin layer, are they more positive versus then the attitudes in the layers of employees who actually do things with patients?
I made a national study about this. What are the challenges, the main challenges in AI adoption in social and healthcare in Finland, in public social and healthcare? We had 50 systemic challenges. 50 challenges. So it's not about technology, it's technology, social aspects, organizational aspect. We want good products, we want funding from the ministries, we want cooperation with universities and other research organizations. We need all the levels, politicians, leadership, employees, and vendors, all together. There's no magic bullet to get this done. We need all the actors.
Yeah, to add, this is a really good comment from Jarmo, and for example, what we have done since we realized there is the same problem is in Mehiläinen. We launched 2 years ago a secure platform for AI tools that everyone in Mehiläinen, every doctor, every nurse, every practical nurse, cleaners, whoever wants, they can use with the same login system that they use their email and their work scheduling software. So that has increased the usage a lot. We have like the users are now, use cases are now counted in millions and active loggers in thousands every month. So that's one of the things that when you make it possible, when you make it easy to access, even though they make just funny pictures with the swarms there, it doesn't matter. They are trying and they are testing it and experimenting in that, and that's the very important first phase.
Yeah, just to continue a little bit, and also on Petja's former comment, I think in the Finnish social healthcare and well-being services counties, we are too afraid of making mistakes, and it's probably also a culture thing because it's healthcare is very hierarchical, and when you think about the AI tools for an employee, they are afraid. They don't know if they can use the tools that they probably know would help them, and this is seen also when we try to approve the new software, like Petja was saying. We do so extensive risk analysis because we are afraid of making mistakes, and this seems to be unfortunately different in other countries.
How about then the attitudes of the customers, the patients? So any comments on that? Like how do they view that the doctors might be using AI for taking notes or helping them make decisions?
I get almost every week emails from our 200,000 residents that please use more AI because I'm a taxpayer, please be more productive, because I've been in media, so people know that we are developing something in Keusote. So I think that's not the bottleneck. Of course, there's resistance and fears, but we have to be very transparent when we use AI. That's the most important thing.
Yeah, if you think about an ambient scribe, for example, which would be kind of visible for the patient as well, we have some scientific papers already on that, and we know that patients are mostly neutral or positive towards it, because of course, I mean, your doctor will look you in the eyes, and he won't be typing on his computer at the same time when you tell your story. So it should be positive, but at the same time, I mean, people are always reluctant about data privacy, for example, and those are questions that arise sometimes. But I think it's also in AI, data privacy is kind of business as usual because we have the legislation in Europe and we know how to assess it.
And data is already handled by IT systems, so there's basically nothing new there, kind of. Yeah.
Yeah, exactly.
Regarding this, Shinya showed this video where this guy was using, I think, Gemini to open the door lock and then asking how to use the washing machine and so on. Do you see a risk that in the future, like radiologists will point their smartphone at I don't know, the X-ray machine and ask the AI model how to run the X-ray machine? Or so is there a risk that we kind of externalize too much much of knowledge to these models? Do medical doctors know how to take notes in the future at all?
Prompt injections, anyone?
Well, I think not talking about the medical profession or healthcare, but in many cases, if you look at how people around their 15, 20 years old, so teenagers nowadays, how they solve things, they are asking it on TikTok or WhatsApp. So anyway, it doesn't matter if they ask how this old-fashioned lock operates from AI or from their friends or peers in TikTok. So the same thing, the AI might be more reliable in that case.
Yeah, than someone on TikTok. Yeah. Let's talk a bit about future. So many of the examples now are kind of relying on like generative AI tools or tools that have been trained on massive big data sets like foundation models. Is that enough? Is generative AI the holy grail for actually making things happen? Or what kind of technical advancements do we need to actually make a change beyond just like simple tasks like note-taking?
Yeah, I guess you might be the best person to answer this from a technical point of view, but I think it's important to understand that the technology of today is very, very capable, and it will take years for us to implement the technology of today. So right now, I'm not that worried about whether the technology will improve even more or if it won't. I'm more concerned about how we can use the technology of today.
We have to start somewhere. Like we are here, technology, and the usage is here. So we have to bridge the gap now, and when the technology goes up, we have to maybe it goes quicker than the adoption, but let's start somewhere. Like I said, from our 4,200 employees, only the majority have not used anything, even Copilot. So there's a lot of stuff to do.
I fully agree on that. And there are tasks that probably we cannot do with today's methods, like actually replacing the whole medical doctor in all the tasks that the medical doctors are doing. But there are a lot of things where we can provide better tools for them to make the work more efficient and maybe more reliable as well. So for long, AI tools were basically used for analyzing data. I think there's, for example, for medical imaging, there's been like different types of tools that measure things from the images and so on, or then different analysis tools to deal with medical data. So then for long, like AI was methods that analyze. And now we are in an era where we have methods that are good with dealing with natural data, images, text, spoken words, and so on, and are good at generating things, as in many examples that we saw here. And we are moving towards an era where AIs act. So one step further, like they might make some sort of decisions, they analyze things and take actions. And I think there is maybe something that where there can be a lot of like useful tools, but then also maybe possible issues. So any views on that, like where are we going? Do we want to have tools in medicine that mostly analyze and like take notes or help make decisions? Or do we also want to have tools that actually act, some sort of like scheduling appointments and doing simple tasks like deciding which like kind of blood samples to take and so on. And then of course probably there would be a human approving things. But are we going to that, or are we still cautious about that? Any comments?
Yeah, well, so obviously right now it's super hard to predict the future, right? I think we as humans have like a natural will to stay in charge and have a human in the loop. But at the same time in healthcare, we are facing very hard challenges and shortages of resources versus the demands. So I think we will be ready to automate some tasks totally. A good example, the one I mentioned with the Hippocratic AIs, avatars that take care of easier follow-up discussions with patients, for example. Or, you know, when you call your healthcare center and want to book an appointment, maybe the triaging could be done automatically and so on. So I think we will proceed in small steps towards even more automation where we won't have the human in the loop anymore.
In very simple admin work, for example, invoices and very specific tasks, there's a lot of good AI agent at the moment. But if there's a lot of process involved, the agent goes rogue, as you have, as you probably know best from all of us. But as Johan said, we don't know about the future, but it's very hard for me that AI agent would, for example, make a clinical decision on my behalf. As a patient, I would very push back on that one. But in the admin side, there's a lot of opportunities.
Yeah, as I mentioned in the presentation, that knowing the work before automating it is one of the key things here, and I see that we have gained a lot of ideas in this point, especially when we have make our engineers to participate the workflows and to see and observe the actual work and to discuss with our professionals, because it's still not so common to understand what are the capabilities of AI tools. So doctors and nurses might discuss over the coffee table about the problems, and if there happens to be an AI engineer listening it, he or she might be able to point out that actually this is something we can do really easily. This is something that doesn't need a whole lot of DPIs or a whole lot of cybersecurity issues are not included, but this is something we can do very easily. So the close cooperation between those who develop and those who understand what are the capabilities of the tools and those who actually do the work is one of the keys at least in the near future.
Yeah, we tend to overestimate change in the short term and underestimate it in the long term. There's this famous quote in machine learning or AI by Geoff Hinton, who recently won the Nobel Prize for his work in artificial neural networks. And a bit more than 5 years ago, he predicted that in 5 years, radiologists are out of a job because of AI. And then separately, there was also a prediction that like no one drives a car in 5 years because self-driving cars will be here. And now 5 years later, if you're a radiologist driving your car to work, like you really know that that didn't happen in 5 years, but change is probably coming. A couple of words about risks. So I recently Googled, and you know, like Google has this AI summary that they write, and I asked about the former like the president of Finland, and the AI summary said that President Tarja Halonen was married to the Moominpappa, that is a fictional character. And this is the flagship product of a tech giant, and it makes mistakes like this. So now, if we're building on top of these generative models, so how to be sure that they actually don't suddenly put something funky in the things that they write or draft? Shinya, you showed examples, impressive examples of like use of generative AI. So how to build the guardrails so that hallucination and other generative artifacts don't destroy the products?
Yeah, thank you. This is really important question. Always ask when I speak in Japan and other countries too. But the hallucination is currently, much lower than before. But I always ask to the people, we don't have a hallucination as a human being. We do. Everyone not 100% as a human, right? Someone told me something, not telling a lie, but it's not correct. He or she thinks this is true, but this is not. It's same, right? So people always say about the hallucination is a risky, but the human being is more risky as of now. Agree? Yes. So don't say that. This is my opinion. But very important point is a human being must be reviewer, must be approver as a key opinion leader or subject matter expert or something like this. So always validation must be done by expert. Then people like human being must be a producer, as I mentioned, must be a director. How to make this technology to like appropriate a direction, or how to use something like this. So never happen to be replaced our labor work by AI. I strongly believe. But if human being works as a robot, as a, I don't know, very automated operation without our brain or something like this, idea or something like this, I think this is, replaced by technology or AI or robot. But idea, creation, art, design, very, very important and must be more valuable, I believe. So very, how can I say, bright future we will see, I think, with the technology, if we can use the technology appropriately.
Very good point. Also, us humans hallucinate. And we always talk about risks, but there's always risks that if we do not utilize this, what is the cost of that we don't use these kind of good products? As a taxpayer, as an employee, as an organization, there's also a cost and risk of not utilizing these technologies.
Well said, well said. I was in this hall last week, and there was a presentation by a rather well-known AI communicator who's very active in social media, and he had an example that what you can use, there are several examples, what you can use generative AI for, and one of his examples was that now you don't need to go and visit the doctor anymore. And because it's expensive, it takes time, and it's tricky to get an appointment and so on. So he had hurt his leg or something. So he showed that he had taken a photo of his leg that has some sort of injury, and then he had asked ChatGPT or Gemini or one of these models what he should do. And he got some answer that he should do this and that. How would you comment on that? Do we actually need any healthcare professionals when we can simply upload images into ChatGPT now?
Maybe we should ask doctors in the panel.
Well, I can answer that. We were really worried when Google came, that we talked about Dr. Google and people Googling their symptoms, and I think we have to be aware of this kind of issue that people are getting answers from LLMs, but I think that will actually increase the respect for real human healthcare professionals, because eventually those models fail, or they produce wrong information, or they don't satisfy your need to be heard or have the interaction. At least in this point, I don't talk about what will happen in 10 or 20 years. So I think that people will value the actual doctor approving their initial diagnosis, even especially if the ankle is still hurting like in 3 weeks. So then there is some orthopedic surgeon who's going to make a lot of money explaining 2 hours, 2 hours what will happen next, and probably fixing the injuries.
Yeah, so I guess the alternative would be that the same person would call their grandma and ask for advice, or I don't know, what did you do earlier? Go to a library and look up from a doctor book or something like this. So probably it's better with ChatGPT. But on a serious note, I would predict and hope that we will have also in Europe and in Finland these LLM-based kind of medical advice softwares that you could use that would be certified under the medical device regulation and validated in a proper way so you can use them safely. That would be a very good direction.
That's a good point, because these generative models can be really good at finding like the long tail as well. So then like helping to think out of the box. Otto is waving at us that yes. So we're moving now. So if any of you have anything that you want to ask, there's one in the back at least. There's someone bold who put up their hand in the back. Yes, you.
Hi, thanks a lot. Stephen O'Rourke is my name. I have a small regulatory company helping startups with regulatory and compliance. Thanks a lot to the panel for the amazing discussions, and to Otto and his wonderful team as well. My question concerns, so as we see AI takes over more cognitive and admin tasks, how are we going to make sure that it actually strengthens rather than weakens the human side of medicine, the empathic side? And then to follow on from that, how should regulation play a role in protecting this empathic connection that we have, and just as it does for safety and performance? So I'd love to get your views on that, especially from the two doctors, of course, from the empathic side.
Yeah, it won't happen automatically, as I said. It needs governance and training. So as I mentioned in my presentation, we have to actually teach our professionals what they should do with the extra time they have when they are using AI tools. And that needs training, that needs frameworks, that how they use their cognitive, the easier, when the cognitive workloads gets easier from the automating tasks, how they can turn it to empathy towards the patients.
Thanks for the discussion. I'm Konsta Tilkainen, machine learning student at Aalto and med school dropout at Helsinki. Petja, you mentioned that only 7% of doctors or clinical doctors in UK you have received formal AI training, but that's still something. Could you expand on what the training is like?
Do you want to rephrase that?
So what is the training like that the doctors have received? Because that's still something that 7% have.
I actually don't remember from the article, but I can send it over. But I think it was quite light and mainly regulatory, like ethics and risks.
maybe I continue that. So maybe Jarmo, can you expand on that training part?
Yeah, we asked our employees what kind of training they want, and it was very practical. We asked the topics. There was like, what's the client-patient work? What tools can we use? Very practical stuff. And the bottom of the list was the ethical issues. And that was surprising for me because there's so much discussion about legislation, ethics, and the bottlenecks on that front. But from our middle-sized well-being services county perspective, that's not the bottleneck, the ethical or legal issues. It's more about, please give us good tools and instruction to use those. So very hands-on training.
Thank you so much for your very interesting exchange of views. My name is Ella Mikkola, and I'm from EY, from Ernst & Young. You have already touched upon the future, but I'm going to ask you in which way this development within AI should be taken into consideration in the education and training of professionals. And it would be great if you could touch upon both the training of physicians, i.e. medical doctors, and nurses, and also, for example, social workers. Thank you so much.
Okay, yeah, maybe I can start. So, yeah, that's a very good and tricky question. I think it's clear for everybody that we need to incorporate AI in the basic training of our social healthcare professionals, right? But at the same time, we need to be very mindful that the professionals really learn themselves as well. So there was a great viewpoint article in the Lancet just like 1-2 weeks ago by Eric Topol, where he introduced the term of never skilling, which means that if you use like too much AI during your training, you might end up never learning the skills you need to be able to be successful in the future. So that's an important and hard question.
One cost-effective way we are utilizing our digital frontrunners. So people who knows the job, the substantive knowledge, and they combine the social skills and the digital literacy. So those digital frontrunners, maybe 5% of our employees are in a very strategic position. We have to utilize those, like Roger's innovation diffusion theory. It's all applies here also. So those are the leverage points, those individuals that have the substantive knowledge plus social skills plus digital literacy, for example.
Just to shortly add what Johan mentioned about Topol's never skills. The important thing is that the university teachers and practical teachers also know the real solutions, how to use AI to improve the care or improve the social work or nursing. Otherwise, the students will use AI the way they see fit, which is basically cheat codes or like workarounds. So they will learn a wrong way, I'd say, to use AI, because still it's very important to actually learn the skills, and you learn those by doing and old-fashioned way of learning. But then you have to have something that's someone who shows you that this is something you can actually use AI to make life or a patient's life better.
Okay, then there's one more question. We have time for that, then we have to move on for the break.
Yeah, thank you. My credentials asking this question is being a husband of a physiotherapist working as a self-employed ammatinharjoittaja in the field. And I'm asking about the legal liability related to AI, because in the private sector, what I've seen is that many are working as self-employed and not necessarily as employees. And it seems that if you're using the AI and you're an employee, you are pretty much protected and covered by the liability insurances and everything of the company. But if you're working as a self-employed for that company, you're not protected at all. And so all the legal liability that comes using to AI is on you if you're an ammatinharjoittaja. Could you comment on that a little bit?
We don't have any lawyers, I guess, here.
Yeah, maybe, I don't know, maybe Petja knows about the
Well,
contracts you have.
I don't know, but I can say that we still don't have had that kind of issues. So I think it will be solved probably in the court when the first issue arrives. But that's a very important topic, and still I would encourage of using those tools when they are certified and like produced by respectable companies.
Well, there's a break coming up, so thank you so much on my behalf. Very good discussion and excellent presentations. So let's thank the speakers.